What's up, dude? I'm just working my core. I'm trying to get that burn. Oh, hey there. This is Dr. Evan Osar. Take two. We shot this earlier today without the microphone working, so Bucky and I decided to give it a second go. He's not very approving of my core exercises. If you work with clients that have low back pain, they often come to you and ask, what is the best core exercise for me? What do I do to feel my core working? And sometimes you give them exercises and you're like, hey, you're working your core. And they're like, yeah, I don't feel it here. So on today's episode of Integrative Movement Insider, we're going to discuss the anatomy of the oblique muscles. Just some brief anatomy to give you some awareness around that muscle. And more importantly, to help you discuss the strategy with your clients, because I have an 86-year-old client and he still asks me, hey, are we working my stomach muscles? I'm like, you got it. Yes, we are. We're always working it, right? Because as you know, every exercise is a core exercise if you are aligning and helping your client control appropriately and breathing appropriately. We'll talk about that here in a moment. Thank you for joining us today. Thank you for being part of our community. So if we look at the abdominal muscles or the function of the abdominal muscles, we're going to discuss specifically the external obliques. The external obliques come off ribs 5 through 12. They fascially blend across the midline through the abdominal fascia into the opposite side internal obliques. They also attach to the pelvis. They also attach into the thoracolumbar fascia as well. They fascially blend with the serratus anterior, which fascially blends up and around the backside of the rib cage. Now, what's a function of our obliques? Really the function of all our abdominal muscles. The rectus abdominis coming from the front side down to the pubic symphysis, and also the internal obliques coming off the iliac crest and up into the underside of the ribs. So what's the function of the abdominal wall? It's really to control the position of the rib cage over top of the pelvis and control the position of the pelvis underneath the rib cage. And if we think about this, this occurs during everyday life. In standing, we want the rib cage over top of the pelvis. When we're walking, we need the abdominal wall to control how far the pelvis goes into anterior rotation as we go into hip extension. We also need it to control how much the trunk and spine go into extension. So if we're reaching up, reaching back, throwing a ball, we need it also to help us rotate and then also control rotation. So it's a rotation. It creates rotation of the trunk, spine, and pelvis, and it also helps to control rotation. So it's decelerating rotation as well. However, through all these motions, I should say, it's also frontal plane motion, meaning it will help you side bend, but more importantly, it will keep you from over side bending. So this right side, my right side, is controlling my left side bend. So it's really controlling the trunk and spine and pelvis, aligning them through all planes of motion. So it's creating motion, however, it's also controlling motion. And the motion is mostly trying to control is to help us maintain, to move out of, and then come back to that most neutral position. So most neutral relative to each individual. So we don't want to force our clients into a specific position, posture. Now, that brings us to another question. Many of us have been taught, many of our clients have been taught to do something to our pelvis, to flatten down the pelvis, or posteriorly rotate the pelvis and flatten down the lumbar spine when we're doing supine exercises. Supine exercises are great for our clients because it really teaches them alignment of their thoracopelvic cylinder. It gives them some kinesthetic feedback about the position of their head, neck, and spine. The challenge is for a lot of our clients, they tend to be, many of us here in the fitness industry also, we tend to be hyperextended at the thoracolumbar junction. So what you'll see here, a little Bucky here, you'll see that they'll have forward head posture, forward shoulder posture, but then they extend at the thoracolumbar junction, the junction between the lower thorax and the upper lumbar spine, and that's where they often get a lot of discomfort, somewhere around this region here, because that's where they're hinging and hanging off. They're basically hinging and hanging off the thoracolumbar junction. However, I want you to visualize the angle of the ribs here. So if you watch Bucky's ribs, when the ribs are aligned in their optimal position, they're slightly higher in the back than in the front. So on me, they should be slightly higher in the back, on you as well. They should be slightly higher in the back than the front. The more we go into that thoracolumbar extension, the more the rib angle starts to change. So now the front of the ribs come up, the back of the ribs go down, we compress the low back, we overstretch the abdominal wall. So now our cylinder isn't quite as aligned as it should be. Well, that also changes the position of the diaphragm. Diaphragm is a dome-shaped muscle sitting inside the cylinder, attaching all the way around the ribcage to the spine. Well, if it's a dome-shaped muscle, it works like a piston inside the cylinder when the cylinder is aligned. However, once we change that alignment, well, now the dome is no longer dome-shaped and starts to angle up. So now when the diaphragm is contracting, it's almost pushing out. And that's why we don't recommend belly breathing for the majority of our clients, because most of them are already belly breathing. That also helps to overstretch the abdominal wall and the abdominal fascia, and that's why you see a lot of your older clients that aren't very big at all, they have distended abdomens because they're predominant belly breathers. They're breathing too much because of the change in their alignment. Now, the older clients can also be thoracolumbar extended, but they're a little bit more in their sway back. So they're still hanging off that low back, that thoracolumbar junction. They're just more collapsed through their thorax. It's a similar issue, it's just a different strategy of how they got there. People that are in the fitness industry, we tend to extend there. Your older clients, they tend to collapse there. So it's relatively the same position when you think about it. It's the rib cage behind the pelvis, or the pelvis in front of the rib cage, or it's a rib cage behind the pelvis extended, or the pelvis in front of the rib cage. For our clients, regardless of where they are, we don't want to force them into a more optimal position. So one of the things that we do with our clients, if you notice in our videos, we never force our clients to pull your belly in, tuck your pelvis under, squeeze your shoulder blades down and back, because again, your client will look better in that alignment. They're not actually in a better position, and it's requiring a lot of effort to be there. Optimal alignment should not require a lot of effort. It may take some thought process and some awareness, but it shouldn't take a lot of effort to be there. That usually means that your client is trying too hard, and or they're trying to overwork, should say overcompensate or compensate for some myofascial compression. So do all your release work that you know how to do your mobility work, do all the things that you know how to do. Make sure you're training them in optimal three-dimensional breathing. And the focus for a lot of these clients is to get them to breathe into this back region. So a very simple, easy way is to have them put their hands, so if you watch my low back here, breathe in and have them expand across that lower rib cage area as they're thinking about being long. So send their breath into that lower rib cage area while they stay long, and as they breathe out, they're breathing out and bringing those ribs down to create that alignment. So they stay long and bring the ribs back down where they belong. The other thing we don't want to do is we don't want to force our clients to pull their belly in and tuck their pelvis under. It's not a great strategy. It doesn't change the rib cage position. I was just working with a student of mine, and she had the flared rib cage, or I should say that thoracolumbar hyperextension, very fit woman, and very flared rib cage. So when she was doing her supine work, she was doing that tuck in. If you just looked at her from the side, you're like, hey, she looks like she's in good alignment. The strategy of how she got there wasn't great, because even though she looked better, it was because she was pulling the pelvis under, posteriorly rotating the pelvis and flattening the lumbar spine. That's important also because it didn't change the position of her rib cage. So I can do that. If I have a flared rib cage, I can move my pelvis and never change my ribcage position. However, if I'm in this thoracolumbar hyperextension, I can change my ribcage, because it also looks, if you notice, it looks like I'm in an anterior pelvic tilt. I can change my ribcage position, put it where it belongs, and it also puts my pelvis in a much better alignment. And I didn't have to do anything to my pelvis, and my lumbar spine is in more optimal neutral alignment. If you look at the research actually shows that the best activation we have of the pelvic floor muscles, of the lumbar multifidi, of the transversus abdominis, so these deep stabilizers whose job it is to maintain activation and control of the lumbar spine and pelvis, they all activate when the client is in a slight anterior pelvic tilt with lumbar lordosis, not when they're in posterior pelvic tilt and loss of lumbar lordosis. If you look at the incontinence research, the research around pelvic floor function, the pelvic floor, there's more, I should say, women that have incontinence tend to have more posterior pelvic tilt and lumbar spine flexion. They've lost the lumbar lordosis. We see that with our clients in our office as well, especially around clients that have chronic low back issues, diastasis, so splitting of the abdominal wall. We see that with clients with incontinence. We see that in clients that have chronic disc issues, lumbar disc issues as well. So we see it with a host of issues. So once you've taught your client how to align get the cylinder better stacked. Then you breathe, because breathing helps to maintain that alignment. So optimal alignment reinforces optimal breathing. Optimal breathing reinforces optimal alignment. Okay. And then you want to teach your client how to take this into specific, or I should say, core-specific exercises. And again, we just have exercises. Some exercises work the core more than others, but they're all working the core. So we don't have any abdominal specific or core specific exercises. We just have chop pattern. So chop pattern is a great pattern for your clients. It's basically just a hinge with aligning that thoracolpelvic cylinder. So again, we just teach our client to align. Hey buddy, get out of the way. He'll watch, make sure I'm doing it well. Give me some feedback. So align the head and neck, align the thoracolpelvic cylinder. So you hinge, grab your ball or grab whatever you got, your kettlebell, and then it's just a chop pattern. So if you're teaching the client to maintain that alignment as they're going through their chop pattern. So it can be with a medicine ball, they can do it with a cable where they're chopping down with a cable, they can do a chop in the frontal plane. So where you're teaching them how to maintain that cylinder alignment through the frontal plane. It's the same idea, it's just aligning that thoracolpelvic cylinder, maintaining that alignment, teaching the abdominal wall to do what it's designed to do, keep alignment, control alignment, and then move through dynamic planes of motion. And that's how you train your core, and that's how the core functions to maintain optimal function, posture and movement and performance. So one of the concepts, again, that I want you to go home with is just understand that, yeah, the core functions through all our exercises. We can train our clients, or we should train our clients with their most optimal alignment, not forcing them into any specific position, or because our training taught us to, we have to have a flat spine. No, just put them in their most neutral alignment where the rib cage is best aligned over top of the pelvis and vice versa. Pelvis is aligned underneath the rib cage. The diaphragm and pelvic floor are relatively well aligned. The client can use their entire thoracolpelvic cylinder in the breathing process and then teach them how to move through their hips, through their shoulders, so that they can start to learn how to incorporate hip, shoulder, and core motion. And that's how you start getting your clients to function at their best level and stop a lot of, or I should say eliminate a lot of this chronic tightness, discomfort, and some of these issues that our clients come to us with. So this is Dr. Evan Osar with Integrative Movement Insider. I hope that made sense. It's probably a lot of what you're doing already. Give you some things to think about, and more importantly, just to help educate your clients on the importance of the abdominal wall, but more importantly, the function of all these muscles around the trunk, spine, and pelvis to maintain this position and reinforce optimal posture, movement. Optimal breathing reinforces optimal posture movement. Optimal posture movement reinforces breathing. So again, it's not independent of they're not independent of each other. They're interrelated. We did a whole entire series of 2 anatomy geeks. Jill and I, the 2 anatomy geeks, we put together a series where we covered spinal anatomy, where we looked at the muscles of the trunk, spine, and core. We talked about the assessments and the corrective exercises associated with this area, so that way you can learn more about this. You can discover how to use your anatomy knowledge to improve your assessments, improve your corrective exercises, and help your clients work towards accomplishing their health and fitness goals in a safe and effective manner. So we discuss these concepts in this series that we did. So the link is next to the bio. So if you're interested in learning more, just check out the link in the bio wherever you're watching this. And we would love to have you as part of the community. It's a great community of individuals that come together that just want to learn, expand their knowledge. And the cool thing about this is I want you to be able to go home and use this information, not just say, hey, here's some muscles, here's some anatomy, here, good luck, go figure it out. No, I want you to be able to go home and use this information with your clients, so that way it enhances what you do and you can attract more individuals that need, want, and will pay you for your expertise. So the link is next to this video or wherever you're watching it. We'd love to have you as part of our community. Check it out, 2 Anatomy Geeks, Trunk, Spine, and Core Anatomy. And we look forward to seeing you in the community. This is Dr. Evan Osar. Thanks for being part of our community and all you do for your community as well, for being leaders and getting out there and spreading the great word, the importance of posture, movement, resistance training, and helping your clients take control of their health. If you have any questions, put them next to this video. I'll be happy to answer them. Make it a great day. We'll see you next time at Integrative Movement Insider. Take care.